Hi, everybody. I'm glad to be on the call. I've been involved in Compass since it got funded, and have done a lot of work around caregivers and the importance of assessing not only the patient but the caregiver. So that's what we just wanted to talk to you briefly about today, on top of what Joan has already shared with you. So next slide. So as Sabina just said, in addition to the focus on the stroke survivors and the outcomes that we're looking at for the stroke survivors, we're also looking at outcomes related to caregivers, particularly around strain or burden. And so in the intervention, we do have some mechanisms to provide some support to the caregivers through providing resources and information on the Compass website. And then at the end, at the 90 days, we do an assessment of what kind of caregiving they're doing, and then do this caregiver strain index, and that's the survey that gets sent out at 90 days. Next slide, please. So the caregivers are contacted by Compass personnel when the patient's discharged to try to get reliable contact information and their relationship to the patient. And so that's something that we hope you all are able to do, is to get us the most reliable information you can related to that. We know sometimes those people change, like you might have an adult daughter that's providing care, and then maybe as the patient gets a little better, then maybe the spouse can take over, or maybe there's not somebody that's doing much of the care anymore. But we'd really like to try to capture as many of these as we can, and as Sabina mentioned, our rates of capture haven't been as good as we had hoped. So again, that's one of the things we wanted to kind of stress so that you can understand the importance of that. Next slide, please. So the questionnaire that we send at 90 days gets some just demographic kinds of information related to the caregivers, and then it does, we do a brief assessment of the care they're providing and the amount and of time and frequency of their post-stroke caregiving, and then we do this standardized caregiver strain index. Okay, the next slide. And if you can hear that phone in the background, I apologize. So this just gives you, if you can see this, for those of you who can see this, it provides a list of the kinds of things that caregivers may be required to do once the patient goes home. So we ask if they're helping, we ask if they need assistance with that, and then we ask also if this was something they were doing prior to stroke, because we got some feedback from some of the caregivers that this was not a new task for them. They had always helped with driving, or they'd always helped with preparing meals or the housework or whatever. So so we wanted to make sure that we were able to separate that out. So this is the survey that gets sent out. This is part of it. And then next slide. Then this is the Caregiver Strain Index. This is a standardized tool that is available. It's a validated tool, and I think it's about 12 or 15 items. It's pretty easy for them to fill out, and like I said, it's been validated in studies with stroke patients before. So this is what we're asking them again to complete, and when they get that 90-day questionnaire. Next slide. So as Sabina mentioned, we've had a really low response rate, and so we're really trying to figure out some mechanisms to try to improve that, especially with the usual care sites, because we have such limited contact both with the stroke survivors and their caregivers. And so we think some of these are potential explanations, that the caregivers don't think that this pertains to them, that if the patient that doesn't have a lot of functional limitations and they don't require extensive or long-term caregiving, then the caregiver may think, well, I don't need to fill this out because it's not applicable. Or that they were providing similar care before the stroke and now after, and so they think, well, this isn't any different, so why would I fill this out? Or again, as the caregivers may change over from the time of discharge to when we send the follow-up. So next slide. What we're really interested in is any ideas you can give us to try to better get these, try to engage these caregivers, or things you can think about to make sure that you really connect with them before they're discharged, so that when we send the 90-day survey, we do get it back. And you can also emphasize the importance, reminding them that they will be getting this, and would they please send it back in, or tell the patients, if they're able to understand, that this survey will be coming out, and could they please encourage the caregivers to complete it for us. So I'm hoping some of you will also have some suggestions about how we can better capture this, get the caregivers to complete this tool.